Urinary tract infections, UTIs, are common bacterial infections that are usually caused by E. coli, further categorized by location along the urinary tract as cystitis or pyelonephritis. Bacteria typically originates in the digestive tract, enters the urinary tract through the urethra, and begins to multiply. The risk factors include shorter urethras in women, incomplete bladder emptying, urinary stasis, and vesicordial reflux. Particularly common among women, UTIs most often occur during peak sexual activity. Approximately 50% of women may encounter at least one UTI in their lifetime, affecting roughly 150 million people globally every year. Urinary tract infections develop when bacteria enter the kidneys or bladder, irritating and potentially causing more serious complications. The urinary system is generally sterile because the strong mucosal barrier, regular urination, and innate immune cells that help keep the environment clean. Regardless, uropathogens can attack the urinary system and change cells in several ways, including adhesion, colonization, biofilm formation, and inflammation, immune system responses, toxin production, and tissue destruction. The bacteria stick to the cells that line the urinary tract and form biofilms that cannot be killed by medicine or the immune system. When someone has a UTI, they get inflammation, which brings in immune cells and harms tissues, leaving scars. The infections are broken down into three groups: general infections, urosepsis, infection of the lower urinary tract, cystitis, and the upper urinary tract, pyelonephritis. The chance of a urinary tract infection can be affected by many things, such as anatomy, physiological conditions, medical tools, immune system disorders, and antibiotic resistance. Lower urinary tract infections cause signs like having to go to the bathroom often, having pain in the abdomen. Upper urinary tract can lead to complications like sepsis and potentially organ failure, both having a high chance of mortality. If left untreated, UTIs can cause kidney damage and further health problems. Modifiable risk factors: sexual activity, frequent intercourse, and spermicide use both increase the risk of UTI development by introducing new bacteria into the urethra. Insufficient fluid intake. Insufficient water intake causes dehydration and may result in concentrated urine, which favors the bacterial environment. Voiding behaviors: postponing the need to urinate, failing to empty the bladder properly, and using poor wiping techniques. These poor urination behaviors can all lead to bacterial buildup in the urine. Non-modifiable risk factors: gender. Women are at a higher risk of UTIs because they have a shorter urethra than males. Age. Risk increases with age, particularly in older women, due to the changes in the bladder function and hormonal factors associated with menopause. Family history. A family history of UTIs increases the individual's risk. Major signs and symptoms. Signs: fever. A fever, elevated body temperature, can indicate the body's immune response to an infection, especially in the upper urinary tract infections, pyelonephritis, that involve the kidneys. Urine that is cloudy or has an unpleasant odor. The presence of bacteria in the urine, a characteristic of UTIs, can contribute to a hazy appearance and pungent, unpleasant odor. Blood in the urine or hematuria. Inflammation and irritation of the urinary tract lining can cause blood to leak into the urine. Flank discomfort or tenderness. If the infection has gone in the kidneys, pyelonephritis, the patient May have pain and soreness of the flank. Symptoms: difficult or painful urination, dysuria. Infection can induce inflammation and irritation of the urinary tract lining, resulting in a painful burning sensation while passing urine. Urgency or frequent urination. The infection can irritate the bladder, generating a strong need to urinate even when the bladder is not full. Abdominal or pelvic pain. Infection can cause inflammation and discomfort in the bladder and the surrounding tissues, resulting in pain and pressure in the lower abdomen or pelvic area. Partial bladder emptying. Infection interferes with bladder emptying, causing the constant sensation of the need to urinate and partial emptying even after urination. Diagnostic testing. Urinalysis. Urinalysis evaluations, such as dipsticks or microscopes, can identify the presence of bacteria and white blood cells in the urine. Dipstick tests detect nitrates, which indicate bacteria, whereas microscopic tests look at urine samples under the microscope to find white blood cells, red blood cells, and other cells. Positive findings, particularly for pyuria, raise the risk of a UTI, but negative results rule it out. Urine culture. Urine culture is a process that isolates bacteria from urine samples to identify the type and quantity of bacteria present. It is the gold standard for UTI confirmation. Identify the individual bacteria is responsible for the illness and what antibiotics it is sensitive to for effective treatment. Blood tests. Blood work is necessary to diagnose complex UTIs, kidney infections, and systemic infections. It evaluates kidney function, looks for infection indicators, and rules out other explanations for symptoms. A complete blood count, CBC, and blood culture are standard tests to determine the white blood cell counts and germs in the circulation. Thank you.